Okay, the neck and head cancer, we are not going into details about cancer and the way cancer develops and the treatment and chemotherapy and radiotherapy. All this will come later in a specific lecture. But we're just going to talk about a particular type of cancer as we are speaking of the upper respiratory tract. But most of this head and neck cancer they are put together because the cancers they mainly arise from mucosal surfaces and are typically there are squamous cell carcinoma, which is serious kind of cancer. Now we're gonna only talk about the cancer of the larynx here, and because unfortunately that's common and has serious consequences on the respiratory system. So as far as the laryngeal, so as far as the larynx cancer, there are so many etiologies of cancer, but there are some kind of cancers are highly correlated to specific lifestyle of specific use or of use of materials. For example, the combination of tobacco and alcohol use for a long time has been correlated or highly correlated with the laryngeal cancer. So, as well as the HPV viruses, but mainly tobacco with alcohol has been reported and documented. So, if you have a patient with laryngeal cancer, it is very likely that when you obtain the history from them, there will be a long use of alcohol as well as tobacco at the same time. So the kind of cancers, basically cancer is a growth, and in this case is because of the lack of nerves. Usually it's painless, and actually one of the latest symptoms of head and neck cancer would be a painful growth, because at that time it's large enough to put a pressure on nerves, and then that's when the patient start to complain of pain. But when it starts, it's just an unexplained growth that usually is painless. Also, a patient may show ulcers that doesn't heal by itself, or do not heal. So, and sometimes it's unilateral. So that's why whenever a patient developed ulcers that do not heal, or change in color and size and or moves around, patient must seek medical attention for that. Now remember again, as we are speaking of the cancer of the larynx, the major symptom of any condition that is affecting the larynx is the hoarseness or the hoarse voice, and that's a serious and an early symptom of that cancer. Eventually, patient may develop leukoplakia, like white patches or red patches around the larynx. This will be seen if we do a laryngoscope. Now, a laryngoscope would be the best way to visualize. Also, we can do a CT scan to see the stage and the size of a tumor. Now, as other kind of cancers, what available for the treatment, there is a medical treatment using chemotherapy. We have the radiotherapy to shrink the size, and we have a combination of that. We are only going to talk about the surgical procedure this time because it's affecting the respiratory system. The rest of the treatment will be covered when we talk about the cancer as an isolated topic. Now, the surgical procedure, there are three different or major procedures. The first one is the total laryngectomy, so which is basically the complete removal of the larynx as well as the epiglottis. Now, remember that the larynx is the connector basically between the pharynx and the trachea. So now this piece of upper respiratory will be removed, so there is no airway anymore between the pharynx and the trachea, and that's why this patient will need a tracheostomy for the rest of their life. It's going to be permanent. The other type, if not early detected, or if the laryngeal cancer spread and went through the lymph nodes and went in the surrounding area, we have to do what we call radical neck dissection. And that involves removal of not only the larynx, but also the lymph node, muscles, blood vessels, lymph nodes, everything that's surrounding the larynx, and that we suspect that the cancer is spread there. Some patients refuse to do that because of the consequences. So the other procedure available is what we call modified neck dissection, which basically be more of conservative and spare any structure that we do not believe that the cancer is involved there. So it spares some of the muscles and some other structures. Now, the major concern here is not only that we're removing part of the airway, so now we have to establish an artificial airway for for a long time, or for forever, but also the epiglottis. And so we know that the function of the epiglottis basically is major for prevention of aspiration. And so now this become another concern. So the patient's swallowing and the patient voice training, that's post-operatively, is very important. So what we call the supraglottic swallow, there's some instructions that you have to give to your patient to compensate for the absence of epiglottis. For example, thin and watery fluids, they pass easily to the airway, so that's something we don't want to give. And that's not only used for a patient who is, if we just remove the epiglottis, even for a patient with a stroke and any patient with a severely weak cough or swallow abilities, we have to do some of the procedure. The most appropriate food for this kind of patient is a pureed, and we have agents like a powder thing. One of the agents called thicket, and so basically it's like powder. And so if you want to give the patient liquid, you add this powder to the liquid, and so you make it thick. Now the thick liquid or thick food, it's easier for it to go to the esophagus because of the mass than it's going to the airway. The other thing is also you want to teach your patient on how to, when they swallow, how there's some techniques in it's called a supraglottic swallow. Basically the maneuver involves first the patient will put the liquid in their mouth, and then they will do Valsalva. And so Valsalva maneuver basically will close the vocal cords, and that will leave there. And so this way it closes the airway. And then ask the patient to swallow now, and then cough right after that and swallow.
Take a small sip of liquid and put it in your mouth, but don't swallow. Now take a deep breath through your nose, hold your breath tight, bear down, and swallow hard. Now gently cough and immediately swallow again.